Hey, I'm going to talk to you guys a little bit about the genogram assignment. So this is inside module 1. So in the introduction for this video, I talked about how doing a really good health history would play into one of the other assignments. And so that's a genogram assignment because you're going to use the information that you obtain in the health history to do this assignment. So let's pop over there and I'll show you what I'm talking about. And this is right at the bottom of module 1. If you scroll through, you'll get to the genogram directions. And so what you'll do is, like I said, you'll take the information obtained, and you might want to read this first to see exactly what you're going to need. It might help guide you a little bit when you do the assignment. So you'll need to get 3 generations of Tina's history. And you'll use pictorial symbols. So represents male, female, dead, alive, certain diseases. And so you'll create that based on the information you have and submit that as one of the documents that will be due for grading for this assignment. So what you want to do is look for patterns. Is there a history of diabetes or high blood pressure, cholesterol, or depression, or something that is consistent throughout the family that maybe you want to address when talking to the patient? And so after you do that, you'll have your genogram, and then you want to create a written summary. So like a paragraph or 2, depending what you find out, identifying all of these things. Just summarize it like you're giving a report on this patient and their health history. And then what you also want to do in that second document, so you'll have your one document, which is a picture genogram, and then your second document, which will contain these 2 sections. So the data summary, and then your recommendations. And this is really the meat of what we want you guys to learn, take away from this assignment is, okay, I have all this great health history, so who cares, right? Do I care? Yes, we should. So what we want to do is, based on her specific history, offer her some recommendations, because all of us, I think, could be healthier. So we want 2 age-specific recommendations. So depending on how old your patient is, because of course, somebody that's 16 versus somebody that's 50, those age-related recommendations are going to be very different. So you want to have very specific age-related recommendations for Tina with the appropriate resources. And we've provided you with a couple. But of course, if you find one that fits your particular recommendation, that's great as well. And then we want one evidence-based recommendation. So based on what is going on with your patient. So for example, she's got a serious history of depression. What's something that you can recommend for her? And again, a really good resource to back that up. So again, you'll have the 2 different documents, the one with the picture, the one with the summary and recommendations, and you'll submit them both for grading by Sunday. So again, reach out if you're not sure about anything, not sure if this is an appropriate resource or anything like that, reach out to your instructor and we'll be happy to help you in any way we can.